Hi, this is Colin Hung from Healthcare IT Today, and I'm joined by Tim Tindle, Chief Information Officer at Spok. Tim, welcome to the program.
Well, thanks very much. Appreciate your time and glad to be here.
So maybe we can get started by having you just quickly describe what is Spok? What do you guys do?
Well, Spok is a healthcare focused communications company with a service line of paging products and services that serves the healthcare industry, as well as communication software products, both on-premise, which help to the contact center to, for instance, route on-call physicians to refer to other physicians and then get messages out to the organization, everything from critical care alerts to calling codes and those type of things. And our new Spok Go platform, which is a new SaaS solution that we're bringing to market, which is for critical communications in the healthcare industry as well. So.
Cool, and I want to ask you about that new SaaS platform in a minute, but you said something there that I thought was interesting. You mentioned paging and pagers. Why are pagers still a part of a hospital's communication strategy?
Well, I'm a recovering healthcare CIO. I spent 15 years as a CIO for Harris Health out of Houston. And, until I entered the healthcare industry, I certainly did pagers before, but in healthcare, if you've ever been in a hospital, there are very, very RF hazard environments. They have a lot of concrete and steel and even lead. And so if you've ever used a cell phone in a hospital facility, there'll be all kinds of dead zones and those type of things. And then a lot of the centers also have tunnels and underground access areas. And so it's just a very hostile work environment. And so paging uses a technology that penetrates facilities much, much better than cellular and Wi-Fi. And even the most work that I ever put into getting our Wi-Fi network working inside a healthcare facility, the reality of it is you ultimately end up with dead spots. But with the technology Spok has, it really penetrates those facilities and provides an assurance that the doctors and nurses and clinicians really, they care about taking care of patients. They care about patient lives, and they can't afford to miss a critical message about a patient. And so the bottom line is it's still the most reliable source to get a message, and so that's why it's continued to be used.
And so in a way, I hear what you're saying is that we actually shouldn't be looking to phase out pagers until such time we can have reliable communications throughout all of the different hospitals.
Yeah, and it, from a technical point of view, we could talk about, the frequencies that Wi-Fi is and cell phones and all that, and that would bore the heck out of everybody. But, there's only so many frequencies licensed by the FCC, and no one seems interested in tackling this problem. And, this older technology that we have continued to refine is still the very best at making sure the messages get through.
And I wonder, have we crossed culturally? Have we crossed the point where pagers are now retro cool again? It's cool to have a pager, because I know for a while it was like, why do you have that? You should have a cell phone or a smartphone.
Well, I think especially I was in an academic medical center, and so you get these new doctors coming out of school, and they look at these as what? But then their colleagues explain to them, and it just becomes part of the fabric. But we also haven't stopped innovation when it comes to paging either. So, but we can talk about that later.
That's cool. Then thank you for that, because that's certainly something that we joke about, of course, pagers, but they are still used, and they are still valuable, and it's important that because it still fulfills a very needed purpose that we continue to use them. We shouldn't just throw them out just because they're old.
Right? Well, if you look at just the price difference.
Oh yeah.
A cell phone or a wireless Wi-Fi phone in a hospital typically runs between $1,000 and $2,000 versus a pager, which costs you a few bucks a month. So.
That's right. So let's change gears a little bit, Tim, and talk about communications in the context of the pandemic that we find ourselves in. what are you seeing has changed? What has stayed the same relative to the way staff members communicate with each other, or how staff communicate with patients?
Well, I think that from a very broad point of view, it's best that everybody stick to what they're used to. You introduce too much change in a crisis, and you end up derailing communications that everybody's used to. And so, fortunately, on the paging side of things, we've seen a lot of pop up or new temporary facilities that are augmenting these hospitals, take care of COVID patients. And so we've been asked to quickly screen those facilities to make sure they have good coverage for paging and those type of things. So we see customers extending whatever they're using today out into kind of this brave new world. So that talks to the devices. And it's a little bit crippling when you're used to having a cell phone that's tied to a Wi-Fi network and you got your EMR attached to it or something, and then you find yourself in the field and are unable to have that same level of support. So I think that's an area where hospitals, once this is over, are going to look to understand what types of solutions are going to be available that allow them that level of mobility, but the level of functionality that the smartphones and some of the other devices that are typically tethered to a facility when they need to be out of the facility. So
it sounds like you're hearing that there's a need for this seamless communications beyond the walls of their physical facility, which is probably something they haven't really considered before the pandemic hit.
Yeah, and having been in Houston, hurricanes were a regular thing. And we set up temporary facilities very similarly to this, but this is obviously on a much larger scale. But yes, that is absolutely the case. I think that in general, this is requiring a tremendous amount of communications between caregivers and the supporting departments, the labs and ancillary departments. But there's also been a dramatic uptick in the need to visit with patients remotely. So telemedicine has gone from a minor exploration for healthcare institutions to one of the only ways that they can continue to see patients safely without having those patients risk becoming infected, coming into a hospital, which is where the COVID patients are. So that's the other big change, is this gigantic shift towards needing to engage patients remotely and how we communicate with them.
Have you noticed anything else around communication and how people are communicating during this pandemic? I mean, you mentioned one, telecommunications, and sort of telehealth is definitely new and different. Are there any other things that you've noticed, given your position in the market?
Well, a desire for instance, remote workers. So one of the things we helped our customers out with was the ability for even the contact center employees who typically take the calls coming into the hospital or call the codes and those type of things, allowing them to remotely do their job from home, which is not an easy trick. And so we have spent a lot of time and offered that free of charge to our customers to help them deal with social distancing issues and really the need for those personnel to be able to work from home. So that's another area, and then many other needs for collaboration and communication. When you're distancing, all of a sudden you become very dependent on devices that maybe you weren't so much dependent on, and solutions. So those solutions in the marketplace that just do simple messaging, secure messaging, are not going to be enough, I think, in the future. We need communication mechanisms that are much more sophisticated, that allow for the inclusion of patient information directly out of the EMR, the things that connect the EMR to clinicians that are more mobile so that they can take action on things that normally they would be required to log into the EMR and find out about, which is really kind of a passive interface to a critical set of information on patients. So I think we're going to see a lot of drive towards, how do I activate that EMR? How do I make that EMR communicate to a physician or a nurse when information is available, not when they're available to log into a computer?
And do you see any of these changes that are happening right now becoming permanent fixtures now in healthcare going forward, or do you see us reverting back to kind of the way things were before?
I think that we will see the pendulum move around a little bit. It's swung pretty hard in one direction. Um, but for instance, with telemedicine and with using communications tools and having to become more mobile and maybe not in the places that you're used to working, I think a lot of those settings are going to remain. I think there's been a little bit of discomfort in the healthcare system with doing a lot of telemedicine. There's been reimbursement issues which have been solved. But this kind of shoved everybody over the edge, and everybody got comfortable pretty quick, and now maybe they're not so afraid of that anymore. But when you start doing telemedicine from maybe home, physicians at home, or home health visits and all those type of things, I think we're going to see a lot greater level of comfort in those kind of environments, and I think a lot of that's going to stay.
Is there anything that you're doing differently at Spok in terms of your development process, or in terms of how you're approaching product design or development because of what's been happening with the pandemic?
Well, we're using we settled on a collaboration tool. We within a few days went from talking about working from home to the entire company's working from home. And, as you can imagine, development teams love to get in rooms and whiteboards and those kinds of things, and they, their creative juices are flowing. But it's been absolutely remarkable, given the tools that we have, how they have really not skipped a beat. And I think that we're getting a lot of good feedback from our customers on some of these emerging needs and changes in this environment that are very likely to stay. Are giving us a good direction on where the market's going to be moving and how we can best satisfy that market. But our development teams are doing great. I've got field engineers across the United States that maintain the paging network, and they've really adapted very well. So it's been very interesting, as it has been for everybody, to learn how to do business in a completely different setting.
That's good. I mean, it is funny how fast you're able to switch, or how fast you were able to pull off switching from being in-person collaborative to being remote and collaborative and implementing these tools. And it's not easy to implement a collaboration tool in a few days. So that's pretty awesome.
And honestly, we have not missed a development deadline yet. So
that's great. That is awesome. So just on that note, what can we expect from Spok for the remainder of the year? What are some of the things that maybe you're working on?
Well, our new SaaS product, Spok Go platform, is kind of a whole relook at communications in healthcare. It's a cloud native solution that was built on the Amazon platform. So it's not some piece of software we had that we stuck in the cloud. It was literally designed in the cloud. And it's intended to be, if you think of an electronic health record as the system of record for a patient and for the doctor, Spok Go platform is the system of action. And so inside EMRs, the nurses and doctors and other folks sit there and they see patients, they document, they follow a workflow to take care of patients and to treat them and to create care plans. And they have wonderful features like alerts. If it looks at the labs and it looks at documentation, it tells a doctor, for instance, that this patient's becoming septic. And if you don't get to them very quickly, the mortality rate on sepsis is really not very good. But the ability to connect that information that's locked in the EMR right now is limited to doctors and nurses going and logging in and open up that patient's chart. With Spok Go platform, we're changing that whole paradigm. We're getting that information from the EMR, and we're reaching out to that care team and letting them know, this is what's going on. You need to take action now. So that's really where the puck is going in this communications. It's activating a passive set of information into creating more real-time healthcare, so clinicians get the data they need when they need it, and we're going to see tremendous improvements in patient outcomes and mortality rates with this type of technology. So very excited about our new platform.
Yeah, I got to ask because, was this something you were going to debut and show at the HIMSS conference? But
In
because
fact, it was. We had well over 100 meetings set up with customers to talk about it, and a lot of our customers have known this was coming, and so there's a lot of pent-up demand to get a first look at it, and so we've had to go virtual like everything else and get back with those customers kind of on a virtual basis. But don't leave out paging. We may have a few surprises there too. We may be coming out with a next generation solution there that's going to surprise people.
All right, I look forward to that. Now, just on the SaaS platform, is it been rolled out anywhere? Is there somebody that's using it as a pilot? What some of the early feedback been?
Yeah, some of the early feedback's been absolutely tremendous. We have development partners, and we also have customers using it. And one of the beauties of a SaaS platform like this that's cloud native is that you don't have to wait for upgrades. It doesn't take an army to upgrade your system. We do feature drops and functional upgrades just almost continuously. So as development occurs and new features come available, it's available in your system, and you can choose to use those new features. So it's really not only a paradigm shift for what the solution does, but how systems work and get upgraded and value gets created for them. The other thing I think that they're reacting extremely well to is this system actually allows the customer to configure workflows in the communication system, so they can sit there and say, when this happens, I want this communication to go out this way. And so it gives them much more flexibility in being able to guide and direct the appropriate communication. So.
And Tim, where can people go to find out more information about this product, your paging products? Where should people direct themselves?
Spok.com, SPOK.com is a great place. We have a lot of assets there for you for folks to look at, a lot of information. And of course, there's a contact us form that you can just fill out and click the button, and someone will get in touch with you to help set up a demo or have a conversation with you, or talk about some of the challenges that you may be having from a communications point of view. We have so much more than I could possibly talk about today, but we'd love to hear from people.
Awesome. Tim, thank you so much for being on our program today. Thank you for taking the time out of your busy day. Really appreciate all the information you shared with us.
You betcha. Thank you. Take care.
This is Colin Hung with Healthcare IT Today. Thanks for listening.